Hi, I'm Nicole, the OT from the Note Ninjas. Today, I want to discuss strategies for communicating for an individual with dementia. So, I have 5 strategies I want to go over. They're quick, easy to apply, and they're so effective. So, it's really important our way that we communicate with patients with dementia. It actually makes a huge difference. Okay, it can get them more engaged, it could reduce some negative behaviors. So, this is really important. Now, the first tip I'm going to give you is to use simple language and commands. You don't want to overcomplicate it. You don't want to give them 5 steps at the time. Give them 1 or 2 and then go from there. So be simple and concise and give clear instructions on what you're going to be doing. Another tip is to make sure that you're in a calm environment. So the more distractions that you have, the more noise, if there's too much light, it could be overstimulating. So if you approach an individual with dementia and you already feel like they're a little bit more on edge, if they're looking around, if they're uncomfortable, maybe it's just something simple as the environment. So maybe somebody is being too loud. So maybe you just need to remove them from the current environment that they're in and bring them into a quieter room to work with them. A third tip is eye contact. Now, this is really important to be making eye contact with the person that you're working with dementia. Now, you don't want to stare them in the face, okay? You want to make it comfortable, but it's important to speak to them in the eye so that they know that you are a friendly person. So you need to build a little bit rapport with them. Okay. Don't just come in there and give them all these demands and tell them to do this exercise. You need to build rapport first and give them eye contact. Now, going along with eye contact is another important tip. Number 4 is approaching from the front. So there is research, and it's well known that approaching someone with dementia peripherally, they lose that peripheral vision. Okay. So if you're coming from the side and then you start talking to Mrs. Jones and they may not realize that you're there, or they might get scared. Okay. So if they're hearing this voice, then they could be a little scared. So it's best to approach an individual with dementia somewhere in the front, get on their level. So if they're sitting, you don't want to be standing over them and talking down to them. You want to kneel down, get to their level, and speak to them gently. And lastly, you want to offer assurance. Okay. So it's important you always want to be in the reality. So if a patient with dementia is talking about their mother, their father, who we all know probably passed away, or maybe they're talking about, oh, I have to get to work, you need to acknowledge that and you need to be in the reality. So don't try to say, oh, you don't have to go through the whole grieving process with them of, oh, mommy's not here anymore. We're not here for that. We need to be in the reality and just kind of go along with their story. And then we need to offer assurance like, oh, okay, yes, your mom is waiting for you and we're going to do this first, but she knows that you're okay. She knows that you're here and doing this with us. And same thing with work. Okay, work knows that you're running a little bit late. It's okay. We're going to walk you to the bus stop and it's going to be okay. So you just want to offer that assurance and it will make all the difference in how you work with patients with dementia. You're going to see better engagement, better participation, and that's what's most important. So I hope these 5 tips helped you, and follow us more for any treatment ideas, strategies, and documentation tips.